Thank you very much. Well, welcome to the Senate Committee on Government Affairs, and I appreciate all of you being here and your participation and being patient with us on the timing. Members, please remember to mute your microphone when not speaking. And Secretary, would you please call the roll?
Vice Chair Orenshaw.
Here.
Senator Goicoechea.
Here.
Senator Neal.
Here.
Senator Hansen.
Here.
Chair Dondero-Loop.
Here. All members are present, and I appreciate that. Just a brief reminder that we will be having public comment at the end of the meeting. And so if you will kindly, we will go to the bills right away. And today the committee will be hearing two bills, Assembly Bill 22 and Assembly Bill 77, both sponsored on behalf of the Department of Veterans Services. And so I will open the hearing on Assembly Bill 22. And when you're ready, please go ahead and begin.
Good morning, Chair Dondero-Loop, Vice Chair Orenshaw, and members of the Senate Committee on Government Affairs, and thank you for the opportunity to present Assembly Bills 22 and 77. Can you hear me okay? Wonderful, thank you. I'll start with AB 22, which requires the establishment and maintenance of a transition assistance program for veterans and servicemen and servicewomen. AB 22 would require the Nevada Department of Veterans Services, with support from other state agencies, to develop a State of Nevada Transition Assistance Program, or NVTAP, to assist those being discharged or already discharged from the Armed Forces of the United States, to include members of the National Guard and Reserve, reintegrate back into Nevada communities. Some returning veterans have difficulty transitioning to civilian life. They experience higher rates of recorded disabilities and associated health concerns than previous generations of veterans. And in recent surveys, returning service members indicate that their greatest reintegration challenges are finding meaningful employment, affordable housing, and affordable health care. There are many programs that can assist returning service members reintegrate. However, service members are often unaware of these programs. The Department of Defense, in partnership with the U.S. Department of Veterans Affairs, does offer a federal transition assistance program, or TAP, to service members preparing to leave the military. However, this program is not available to members of the Nevada National Guard or to reserve forces in Nevada. Additionally, federal TAP focuses almost exclusively on federal benefits, providing very little information about state and local veterans programs and services. The limited state information that is offered in the federal TAP is specific to the state where a veteran is immediately ending his or her service, not the location of their intended permanent residence. In short, they may learn about the benefits that Texas offers if they leave Fort Hood, or that Oklahoma offers if leaving Tinker Air Force Base, but they will not learn about the Nevada programs and services that are essential to their successful transition home to Nevada. Many recent surveys also show that state programs and services are the most valuable to transitioning service members. At the top of the list are local employment, housing, and health care, and of course K through 12 enrollment for service members who have children, all programs offered by the state and local governments, nonprofit organizations, and private businesses here in Nevada. The intent of this legislation is that Nevada offer an in-person state transition program in Clark, Washoe, and Churchill counties, supported by specific state agencies using existing resources. Those counties, because that's where you have Nellis, Creech, and Fallon. And then in Washoe County, you have your large population of Nevada National Guard and reservists. NDVS would also create an online version so that service members on installations outside of Nevada could learn about these services before leaving service and returning to Nevada. So they wouldn't have to wait till they got here to find out how to enroll their kids in school or how to get on the Silver State Exchange or how to, some of the benefits that are associated with housing, such as the Home is Possible for Heroes program under Business and Industry. This program would also be valuable to recently separated veterans relocating in Nevada. In-person participation would not be required by agencies supporting the program. In some cases, they might just simply be providing information in forms of existing brochures or online links. And participating state agencies could include the Department of Business and Industry, Department of Education, DETR, Department of Health and Human Services, the Silver State Exchange, Nevada System of Higher Education, among others. And Madam Chair, this concludes my overview of AB 22. Did you want me to go into the overview of AB 77 or stop at this point for questions?
If you don't mind, if you would stop at this point so that we can ask you questions. Committee, any questions from the committee?
Yes, Madam Chair.
Senator Neal, please.
Thank you. So I had a couple of questions. So in the bill SB 22, it cites the federal statute, but I guess what I'm trying to figure out is some of the things that you have listed, like the workforce, employment, vocational training, the USC that you listed in the bill. It's mandates that you work with other entities, but how are you working with like the workforce programs that are in Nevada to try to make sure that they're connected? Because that's been going on for a while. And also the starting and maintaining a small business. I just know that there's already existing programs, and I don't understand why veterans are not connected to it, or why the Office of Veteran Affairs is not connected to these programs that have been going on for years.
Ma'am, thank you for the question. So let me talk you through an example. Let's say a veteran, a service member is in Fort Polk, Louisiana.
Ms. Miller, I'm sorry to interrupt you. Would you say your name for the record?
I apologize, Chair. Kat Miller for the record. So I'll talk you through a specific example, a couple of them. Let's say that there's a veteran in Fort Polk, Louisiana, and they're preparing to come to Nevada. And then we'll take somebody that's at Nellis already. So Fort Polk, Louisiana, if you're at Fort Polk, you might go online and try to find information about a job in Nevada. And there could be resources out there. There could be a lot of resources. In fact, there's so many resources, you're not really sure where to start. And so you don't have a navigator to the many programs and systems that are taking place in Nevada. There was a case not too long ago of a Navy couple who had relocated to Nevada, and they were trying to buy a home, and they were standing in line at a grocery store and talking about trying to figure out the best cost to do a home. And somebody heard them and said, "Oh my gosh, did you know there's this special mortgage rate, that you can work through business and industry under Home is Possible for Heroes?" And they didn't know about it. So what this program would create is a space, both online and in person, that would bring everything together for the service member. Now, the federal government has been doing that for a long time. And you talked about workforce development. For example, DOL has you talk about small businesses. And there is a small portion of the federal tap that says if you want to buy a business, right, or if you want to open a business, or if you want to be an entrepreneur, how you would go through that. But it doesn't really translate to what you do in Nevada and where you can go to Nevada for help. So we worked very hard at connecting veterans to these services, but it's still disconnected. And this would bring it together in a way, both online and in person, that the veterans could. The idea in the online in the in-person program, in the morning, you might just get some quick introductions to all the different agencies, and then they would be there, and you would be able to go to their table and say, "How do I sign up for health insurance in Nevada?" And they'd be able to help you on the spot. "What do I do about K-12? How do I get my children in school in Clark County?" And there would be a representative there. And so it would have the resources there. Quarterly, we would do this training is our idea at Nellis and Creech and Fallon. But for those that aren't in Nevada, they could go into an online website, find the topic they need, hit it, and go directly to that link. So you don't have to go to 50 different locations to find the information you want. It is all in one bucket that you would be able to find the most commonly asked questions about resources that you need.
Thank you, Madam Chair.
Thank you very much. Additional questions? Vice Chair Ornshall, please.
Thank you, Chair, and thank you for presenting the bill. My question, and I'm just wondering if AB 22 passes, do you feel you have the staff and resources to implement this program? It certainly sounds like a great idea, but I'm just wondering, do you think it's implementable with what you have now, or?
Kat Miller for the record. Vice Chair, yes, I do. And I say that because these organizations within the state agencies listed all have outreach and information arms. So it's really a question of bringing it together. We're already leaning forward to develop the online program. And what you're talking about is a quarterly in-person TAP that would occur at the major installations in Nevada. We based this off a program that was conducted in California, CalTAP, and several other states picked it up as a best practice. But I'm comfortable after taking a look at all of the requirements that we could accomplish it with existing resources.
Thank you. Thank you, Chair.
Thank you very much. Additional questions? So, Ms. Miller, I have a question for you. You mentioned Nellis and Creech and the National Guard. I don't see those identified in the bill, so would they just naturally be focused on that because those are our bases in Nevada?
Kat Miller for the record. Chair, those would be the major locations that we would do it, but there are other active duty elements in Nevada. You've got the Corps of Engineers that are located in Nevada. You've got out at Hawthorne, there are a few service members there. So there are other active duty service members in Nevada, but that's where we would do the larger activities. There really isn't a big, to bring together a whole bunch of folks quarterly to be at Hawthorne for 2 service members wouldn't make sense.
Sure.
And so for those locations, the online offering would make more sense for them.
And do you have somebody in place that will be able to do this information onto online? In other words, they're going to be able to insert that and follow through with this technology?
Kat Miller for the record. Chair, we do, but it's not just us. So the online offering is a portal that goes to, you would look at it and there'd be a list of things and, housing. And so it would link to the active links to the different agencies, education, for your children through your K-10. And we have worked with all the state agencies that are listed in the bill, and they're excited about it. And we already know who their points of contact are. So it's not just one person, it's state agencies committing to coming together to make sure that their links are live and it's the correct information. What we've been able to provide as a department is what are the most common needs of those transitioning service members, what information do they need, and so we can make sure it's packaged in a way that's beneficial to them.
Thank you very much. Any additional questions for our presenter? All right. Thank you very much. We will quickly go to our public and go to support, opposition, and neutral. And so broadcasting when you're ready.
Thank you, Chair. Good afternoon. If you would like to testify in support of AB 22, please press star 9 now to take your place in the queue. Caller with the last 3 digits of 747, please slowly spell and state your name for the record. You have 2 minutes and may begin.
Chair and committee members, my name is Andrew Lee Pilbit, last name Lepeilbet, and I represent the combat wounded veterans in the Military Order of the Purple Heart and the nearly 70,000 disabled American veterans, and I'm the current chair of Nevada's United Veterans Legislative Council. I would have to say after Director Miller's testimony, I'd have to go ditto, ditto, ditto. Transition assistance is a key element to add to hers. Its key element is the feds have recognized for years it's overdue for us here in this state to simplify it and make our veterans productive when they come home. Because many of these veterans that are coming back to Nevada are Nevadans just returning home. So the United Veterans Legislative Council fully supports this bill and hopes for your agreement and voting for it. Thank you very much.
And thank you for your service. Next caller, please.
We are currently on support of AB 22. If you would like to testify in support, please press star 9 now to take your place in the queue. Chair, you have no more callers in support at this time.
Thank you very much. We'll go to opposition.
If you would like to testify in opposition of AB 22, please press star 9 now to take your place in the queue. Again, if you would like to testify in opposition of AB 22, please press star 9 now. Chair, you have no callers in opposition at this time.
Thank you very much, and we'll go to neutral.
If you would like to testify neutral on AB 22, please press star 9 now to take your place in the queue. Again, if you would like to testify neutral on AB 22, please press star 9 now. Chair, you have no callers neutral at this time.
Thank you very much. And with that, Ms. Miller, do you have any closing comments on Assembly Bill 22?
Madam Chair, Kat Miller for the record. No closing comments, ma'am.
Okay, thank you very much. Then we'll close the hearing on Assembly Bill 22, and we'll open the hearing on Assembly Bill 77. Please
Thank
go
you,
ahead
Madam.
when you're ready.
Thank you, Madam Chair. Kat Miller for the record, Director, Nevada Department of Veterans Services, testifying on AB 77. AB 77 revises provisions concerning the Department of Veterans Services and certain advisory public bodies related to veterans. AB 77 would revise provisions concerning our department. Specifically, it would revise the duties of the Director of the Nevada Department of Veterans Services to capture significant and essential duties already being accomplished, and change the terms of 4 veterans advisory commissions and committees to standardize the numbers of years for which members are appointed. I'll start with director's duties. NDVS currently creates, coordinates, and supports suicide prevention and homelessness programs with existing staff and resources. These issues have been top concerns for veterans and their families for the past decade. However, they are not listed in the Department Director Duties section of NRS 417, even though there is mention of other at-risk and special population veterans. For example, women veterans, LGBTQ veterans, veterans suffering from MST, etc. Adding these duties to NRS 417 codifies what is already in place. The duties already being accomplished but not captured in NRS specifically that would be added: connect veterans experiencing homelessness to housing and to organizations that provide housing support to decrease homelessness among veterans, and create, coordinate, and support programs and resources for the prevention of suicide among veterans, including, without limitations, programs and resources to increase knowledge about how to recognize the signs of potentially suicidal veterans, and resources to which veterans who are potentially suicidal may be referred. The next section is commission and committee term length. There is 1 Veteran Service Commission, 2 Cemetery Advisory Committees, and 1 Women Veteran Advisory Committee established in NRS 417. The Veteran Service Commission, or VSC, and Cemetery Advisory Committee members are appointed for 2 years, and the Women Veteran Advisory Committee members are appointed for 4 years. The Nevada Veterans Service Commission believes that 2-year term limits are too short for significant service and result in turnover, disrupting continuity of operations. A longer 3-year term would develop expertise and awareness among board members. 50% of the VSC and cemetery board members turn over annually. According to Board Resource in their 2017 report on board practices, ideally boards should turn over no more than 1/3 of the board seats annually. Moving from a 2-year to a 3-year term length will keep that turnover to the 1/3 goal. With 2-year term limits, the governor's staff must appoint or reappoint 10 to 11 members annually, creating not only significant workload and creates resultant appointment delays. Adopting a 3-year standard term would reduce that workload and associated vacancies and get us to about 7 appointments required a year. Now, the Women Veteran Advisory Committee 4-year term length does allow for continuity of operations and minimizes appointment process workload. However, the 4-year term length is also not optimal because it's important to bring in new members regularly to generate fresh ideas and to bring on different members with different cultural viewpoints, skill sets, perspectives, and networks. Adopting a standard 3-year term would support a culture of inclusion and innovation. Finally, NRS 232 Alpha, appointments by the governor to public bodies, establishes a general requirement of appointments for 3 years until their successors have been appointed and have qualified. While NRS 323 Alpha does not limit additional requirements imposed on public bodies, after a review of the statutory responsibilities of veterans boards in NRS 417, I can determine no special circumstance that would suggest a need to deviate from the general term length requirement in NRS 232 Alpha. And Chair Dondera Loop, Vice Chair Orangeshall, and members of the Senate Committee on Government Affairs, this concludes my presentation on AB 77, and I stand ready to answer any questions you might have.
Thank you so much for that information. So questions from the committee? Senator Neal?
Yes, Madam Chair. Thank you for that. I guess, my question is on the section around homelessness. How come you guys aren't already a part of like the continuum of care that's going on in Clark County? Because they have dollars, or I believe they have dollars that focus on homelessness for veterans. I mean, typically when the federal money comes down, it's very specific and it may not go towards something else, but it may, it'll go towards veterans. And so there's been work going on. I guess, just like the bill before, I'm confused about how you guys connect with other agencies, local, that are a part of the work that you're trying to be involved in.
Madam Chair, Kat Miller, for the record, through you to Senator Neal. Thank you for the question. We are connected. We are connected not only in Clark County, and we sit on all of their boards. We're connected with the regional area homelessness up in northern Nevada. We have brought in mayors and governors challenges for Las Vegas, for Elko, for Truckee Meadows. We have more mayors and governors challenges to end veteran suicide and homelessness programs than any other state, according to the VA, in terms of resources. So this is not about not connecting. I'm very comfortable with our ability to connect. It's about codifying what we're already doing in NRS. So this doesn't say you must do this. We're already doing it. This just puts it in NRS because currently all of the work we're doing in the space of homelessness, whether it be sending folks out to do point-in-time counts, putting in for grants and getting money to come in to support our communities, both the urban and the rural areas, connecting veterans to the resources that they need. There are many, many resources our veterans are eligible for that other folks that are without, that are homeless do not have access to. And so we have a very tight team between the VA, between our local counties, between our state resources. And again, this bill does not at all suggest that we need to do work in this space. It's saying we need to codify the work that we are doing to make sure it continues on in the future. So I would be more than happy to to send something to you, Senator, that lays out everything we're doing in the space of homelessness. I think you would be pleased. And there's been tons of progress on the issue of veteran and veteran family member homelessness in Nevada. I wish the resources were there for every Nevadan that there are for veterans.
Okay, thank you for that. Because I just, I appreciate you saying that you were trying to codify it, and I guess that makes sense, but I just assumed that it was a part of like the services and, there was regulation or something else around it. But if you need it in law to continue to make it happen until 2028, then, okay.
Madam Chair, Kat Miller for the record, if I can add one other thing on that.
Please.
And Senator Neal, the nature of the Nevada Department of Veteran Services was really very siloed till about a decade ago. We ran cemeteries, we ran veteran service officers who did claims, and we ran nursing homes. And that's what we did. And that was it. So, as we went out, and I can't take credit for this was several directors past me, and as they're looking at the needs of veterans, they were much broader than that. The needs of transitioning veterans, they don't need cemetery services immediately. They don't need nursing homes immediately. What they need is housing. What they need is healthcare. What they need is education for their children and college for them. And so our department was really not serving the needs, all of the needs of all of our returning members and all of our veterans. And we've done some amazing things. I'm so proud of my team and what they've accomplished over the last decade. But it wasn't codified in NRS. NRS really focused on those three core missions. And I think it's really important to address the fact that this department has to get at the real gaps in services, the real needs for our veterans, not just those big three, if you will. And that's part of this. And we've, over the last 10 years, it's, women veterans are in there, the needs of those veterans that are homeless, and so we're getting to it. But these are two really important missions. For the last 4 sessions, the number one issue addressed by veterans in the Veterans Legislative Symposiums have been veteran suicide. And there's nothing in NRS that said the word suicide. One of the top 5 has always been homelessness among veterans, not mentioned in NRS at all. And I think it needs to be there just as much as operating cemeteries and operating nursing homes. And that's the reason for asking that the language be codified in NRS.
Thank you. Thank you, Madam Chair.
Thank you. Additional questions, Vice Chair Orenshaw.
Thank you very much, Chair. I think my question's in line with Senator Neal's question. The language on page 4 about connecting veterans experiencing homelessness to housing and organizations that provide support in housing and other related access to decrease homelessness among veterans. I just wonder, a lot of veterans experiencing homelessness may not have a reliable cell phone. They may not have access to the internet. Does the office try to, reach out at homeless shelters or other areas where veterans might be getting services, or does it depend on them reaching out to the office?
Kat Miller for the record, through you, Chair, to Vice Chair Orenshaw. We do reach out. And one of our most important missions is a bridge between the VA and local communities. So the VA has many resources. The VA has personnel that can support, you can get a veteran connected with them. They can help them with all types of assets. So can the local communities. So we're really, one of our biggest responsibilities, I think, and one of our biggest benefits is we serve as a convener to bring together local, state, and federal government assets around the space of veteran homelessness. And we've done several wonderful convenings, but often the people won't know each other. You'll run into somebody doing incredible things in Elko, in the local, Department of Health and Human Services, and they won't be aware of the Salt Lake City VA resources that would be available, whether they be financial resources or mental health resources that would be available for veterans. So a lot of what we do is make sure we understand what's out there in the space for veterans experiencing homelessness, so we can bring the community together to make sure that all assets are being applied.
Thank you.
Thank you very much. Additional questions? So, Ms. Miller, and I know this is part of the other bill, but is the information easily accessible? So I know sometimes when we have a homeless veteran or a person with mental illness, things may be different, but is the information accessible so that if they get on the street, they can get help, or if they're on the street and they're suicidal, they can get help? Is it easy for them or seamless for them? I hate to use the word easy, but seamless for them to find this information so that they can get help?
Kat Miller, for the record. Chair, there are certainly barriers to getting information about programs to those that are homeless that are not there for those that are housed. And it is a problem, but I will tell you over the past 6 years, starting, I think, with the Las Vegas Mayor's Challenge to address homelessness that came in with the VA, a community-based program. And really, they declared functional zero, which means that all the veterans that they knew about that were experiencing homelessness were in programs to address that in housing, with the exception of those who chose not to participate. Why they call it functional zero is tomorrow a service member could get out, a veteran could lose their job, so that is a constantly changing situation. But the VA has permanent staff members who go out. Our team has folks that go out with a point in time. We have folks on all the, and I'm sure you know more than I do on this because it's been a while since I've been to the Las Vegas one. But there is a group that comes together down in Southern Nevada, one in Northern Nevada, and one in Eastern Nevada, where all the players come together that are offering services, and they do crosstalk to make sure that you do have those wraparound services. I think when it comes to veterans, it's been a real success story in terms of helping them get the information they need, but often it means getting out on the streets to get that information to them, because you have to find them first. And then when you find the veteran, the VA has really relaxed. Before, you had to have certain character of discharge before you could get services. It was a very convoluted system. They have eliminated a lot of those barriers to getting support to the veterans. Offhand, our biggest problem in the last couple of years has been the vouchers for, I'm drawing a blank on what the name is, the HUD-VASH vouchers. So HUD-VASH gives a certain number of vouchers to each state every year that helps with housing for veterans. And we had a problem there about 3 years ago about getting enough HUD-VASH vouchers. And right now we're in a much better place for our veterans. But it's something we keep an eye on all the time. So I'm sorry, I know I was all over the map on that one, but the shorter answer is, yeah, it is really hard to make sure people who are experiencing homelessness have information about the resources they need. But we work really, really hard to help bring the community together to get that information out.
Okay, well, thank you for what you're doing, because I think this is certainly a necessary piece of legislation. If you have no further comments, we will go to, and I don't see any further questions, we'll go to support with broadcasting.
Thank you, Chair. To testify in support of AB 77, please press star 9 now to take your place in the queue. Caller with the last 3 digits of 747. Please slowly spell and state your name for the record. You have 2 minutes and may begin.
Chair and committee members, my name is Andrew Lee Pilbit, last name L-E-P as in Paul, E-I-L, B as in boy, E-T as in Tom. And I represent the combat wounded veterans of the Military Order of the Purple Heart, the 65 to 70,000 disabled American veterans, and I'm the current chair of the United Veterans Legislative Council, representing nearly 250,000 veterans in our state and 500,000 Nevadans when you consider their families as well. Again, I have to say ditto multiple times to Director Miller's comments. We are in full support of AB 77. We look at this as some necessary common sense changes to NRS, standardizing committee member position times to 3 years makes sense instead of being on multiple committees, 2 years on this one, 1 year on that one, 4 years on this one. It's just common sense and good management to clean up that part of the NRS. So the United Veterans Legislative Council is in full support of AB 77, and we look forward to your votes. Thank you.
Thank you very much. And once again, thank you for your service. Next caller, please.
If you've recently just joined us, we are currently on support of AB 77. To testify in support, please press star 9 now to take your place in the queue. Chair, you have no more callers in support at this time.
Thank you very much. Can we move to opposition, please?
To testify in opposition of AB 77, please press star 9 now to take your place in the queue. Again, to testify in opposition of AB 77, please press star 9 now. Chair, you have no more callers in opposition at this time.
Thank you very much. We'll go to neutral.
To testify neutral on AB 77, please press star 9 now to take your place in the queue. Again, to testify neutral on AB 77, please press star 9 now. Chair, you have no callers neutral at this time.
Thank you very much. Do you have any closing comments, Ms. Miller?
Madam Chair, Kat Miller for the record. I would just like to close with this. In NRS 417, there is a list of duties of the director. Since there is a list of duties, I do believe it should be comprehensive, and those major duties, those most needed and most important to supporting the veterans who have served us and served our country, should be listed. So thank you very much for the opportunity to testify today, both on AB 22 and AB 77.
Thank you very much, and thank you for working so hard and diligent on all of this. It's an important subject for us. Ms. Miller, you cannot leave here without one last question. We are all very envious of the books behind you, and we want to know, are those really books or a background?
No, I'm downstairs in my bedroom. See my daughter's picture.
We are all very envious and jealous, and we would like an invitation to your home to view them in person.
Thank you. I appreciate it, Chair. Kat Miller for the record. And yes, I am calling in from home today. I'm hoping very soon we can get back to full operation in our offices. And thank you, Chair.
Well, as a former school librarian, you can imagine that I love books. So there are others on this call that feel the same. So thank you for putting all the discussion to rest. We know now they're real. So thank you very much. And thank you again for joining us today.
Thank you, Chair Dondero, Loop, and Kat Miller for the record. I would like to say that when I went to school at UNLV, I did work in the library there and shelved a lot of books.
There you go.
Not a librarian, but I did work as a librarian at UNLV many years ago. So.
Well, there you go. Okay. Thank you very, very much. All right. With that, I will close the hearing on Assembly Bill 77, and we will move on to our period of public comment. We are going to wait just a minute to give our members of our public time to join us. And please remember during public comment period that you are invited to comment on matters not concerning the two bills we just heard, but any other comment that you would like to make. And please clearly state and spell your name. And remember, you have 2 minutes to speak. So broadcasting, when you're ready.
Thank you, Chair. To speak in public comment, please press star 9 now. Caller with the last 3 digits of 072. Please slowly spell and state your name for the record. You have 2 minutes and may begin.
Good day, Chair Dondero, Loop, and members of the committee. My name is Valerie Frisky, VALERIE FRISKEY, I'm a resident of Dayton, and I retired after teaching for 45 years in Nevada, with the last 37 years in Lyon County. I'm active in the Nevada State Education Association, retired, and I'm here to encourage you to consider the need for all education employees across the state to have access to quality, affordable health care upon retirement. Our members are facing escalating costs of health care and prescriptions. Please keep in mind that Nevada is a WEP GPO state, and many of our retired members won't have access to affordable health care because they won't and don't qualify for Social Security and or Medicare. Currently, as my colleagues retire, they face insurance costs from $800 to $1,000 and more per month after spending their entire career as public school employees. We are asking for the legislators to fund a study on retiree health care for education employees. I understand that the state is facing very serious budgetary restraints this year, but hopefully we can get a survey, funding a survey. Thank you for your time.
Thank you very much. Next caller, please.
Chair, you have no more callers at this time.
Chair, you are unmuted.
It has to happen once a day to all of us. I think with that, we are finished with our meeting, and thank you all for attending. Our next meeting will not be until next Wednesday, April 21st, and we will be live. You will still be able to join by Zoom, but please know that we look forward to seeing some of you in the building and most of you online as well. So thank you very much, and with that, we'll adjourn. Thank you. We're adjourned.